So I've probably got quite an interesting backstory really, because I was first diagnosed with cataracts at a very early age, which is quite unusual as I understand it. So I was about 10 when I first had a diagnosis. I ended up going to the Moorfield Eye Hospital when I was 14 and had one cataract removed and a plastic implant, which was quite unusual for that sort of age. And then in 1990 I had the other eye cataract operated on at Moorfields. So by the age of 25 I'd had both cataracts removed and plastic implants put in. So because of the cataracts, I actually was very careful to make sure that I always went for checkups with optometrists, and so I'd always had annual checkups. And then more recently in 2021 I came to Arthur Hayes for the first time. The cataracts had always changed slightly, so the actual prescription that I needed in my lenses was changing with my eye growth, I guess, and so I had new prescriptions, but never had any issues with any high pressure in my eyes, and so I came here following quite a number of positive reviews from family and friends that have been here in late 2021, and so I met Lucinda for the first time then, and completely surprisingly my eye pressure was off the scale in one of my eyes, and to date I'd never had an issue with high pressure, and I didn't know that there was any family history. As it turns out, Dad hadn't mentioned it to me that he'd had high pressure, which he was controlling with drops. So I came here in November 2021, saw Lucinda, high pressure in one of the eyes, the other eye was okay, and she quickly referred me to a specialist glaucoma consultant at the McIndoe Centre. Within a couple of weeks I'd had that appointment and was on drops and a programme of trying to control the ocular hypertension. They tried some laser surgery to reduce the pressure, which partly worked, and so from going on 2 drops a day I'm now down to 1 drop twice a day, which is positive, and the high pressure is now under control. So I was, I think, 35 in my right eye and 15 in my left when it was first picked up by Lucinda, and then it's now, the last time I came back here, it was down to I think sort of 15 and 15, so back in a normal, more of a normal parameter of where it should be. So under control, and thank goodness I came here and it was picked up. I think what was really good was that she very quickly picked it up as being a significant problem. We then very quickly had a conversation about where I go from here, because I clearly, if ocular hypertension isn't dealt with in a quick way, there is potential for damage to the optical nerve, and therefore glaucoma can occur. So it was very important to me to try and get that fixed as quickly as possible, and Lucinda has got very good contacts within the eye field, and so she referred me to a specialist that she knew locally, who could see me within 2 weeks. So having her expertise to both pick it up and then to point me in the right direction as to where I needed to go and what needed to happen next was really important. And so within a couple of months of seeing Lucinda, I was in a position where the pressure was under control, and I was on the road to, not necessarily recovery, but certainly on the road to managing the problem and hopefully avoiding glaucoma and any optical nerve damage. Well, I guess if it hadn't been picked up, then glaucoma is the natural progression from ocular hypertension, and if you get the damage to the optical nerve, then potentially the next step is blindness. So clearly, by having this picked up and dealing with it quickly and efficiently, and as it has been, It's hopefully I've managed to preserve my sight, and to date there hasn't been any damage to the optical nerve, which I'm really grateful for. I decided to actually come and visit a professional sort of independent optician to see what the difference was between what I'd experienced over the previous sort of maybe 10 years and what I'd been told was really good care from family and friends. And I think Lucinda has proved in what she has managed to pick up and then direct me forward has just been invaluable.